So I'm going to start the webinar now. Welcome everyone. Thank you very much for joining us for the launch of the report Health and Wellbeing in the Private Rented Sector, Enhancing Capabilities. I'll just introduce myself first. I'm then going to say a little bit about how we'll run this webinar, and then I will introduce the speakers and just take you through the running order. So my name is Linda Bauld. I'm a professor of public health in the Usher Institute in the College of Medicine at the University of Edinburgh. I'm really delighted to be chairing this session. A number of years ago, I was fortunate to be based in urban studies at the University of Glasgow, so I've really followed the research not only that's been done at Glasgow, but Stirling and many other places on this topic. It's hugely important, and I think for me, it's particularly important as we look ahead to COVID recovery and trying to support across the UK, the sector, landlords and tenants, of course, also in terms of their relationships and the legal and regulatory framework. So I think this is a really important report. I think it also emphasizes a broader context around understanding well-being and goes beyond traditional survey responses to look at really people's experiences and takes a qualitative perspective. It also takes into account the wider context, changes in the law and the regulatory frameworks that are relevant. And I think highlights a need for a number of things, including education and advice for tenants and landlords, and really looking at that landlord-tenant relationship. So I'm sure you will find this webinar really informative. In terms of how we are going to run it, we have, as you can see, those of you that have had a chance to look at the agenda, we've got 4 blocks of presentations, and we are going to have a panel discussion with most of the speakers at the end. So I guess my key ask from all of you attending is to listen to the speakers, and then please put any questions you have for them in the Q&A box, which you'll see at the bottom of your screen. So not the chat, but the Q&A box. And you will then be able to, I will be able to see those questions. And when we get to the panel discussion section, I will pose them to the speakers. The only exception to that is that for the first presentation, where you'll see we have Dr. Jennifer Harris, but also Vicky Card, who's a PRS tenant, speaking. Vicky has to leave us, so I will pause after Vicky has spoken and to see if there's any questions, either from other members of the panel, which I would welcome, or from the audience for Vicky, and then we'll move on to the remainders of the presentations. And the only other thing I want to highlight importantly is thanks obviously to the funders of this work, who are the TDS Charitable Foundation and also Safer Deposit Scotland Charitable Trust. So many thanks to them. So let me now move to introduce the speakers, and then I will hand over to Dr. Harris. So we have a number of really excellent and experienced speakers with us today, coming from a range of different types of experiences. So Jennifer is Senior Research Associate for the UK Collaborative Centre for Housing Research and is based within the School of Policy Studies at the University of Bristol. And you'll see the rest of her biography. I think you've been provided with that. Dr. Kim McKee is Head of Housing at the University of Stirling and a co-investigator in the UK Collaborative Centre for Housing Evidence, and she's a qualitative social scientist. Vicky Card is a tenant with experience of living in the private rented sector. Michael Tornow, Michael is Senior Health Improvement Officer with Public Health Scotland, and he was involved in preparing the Healthy Housing for Scotland briefing paper published by Public Health Scotland. That looks at current evidence on how housing can influence health and well-being, and that's intended to support housing to 2040, which is the Scottish Government's vision for the housing system over the next 20 years. Joanna Seymour is Project Manager at Warm Wales. She's a qualified environmental health practitioner with an MSc in environmental health from Birmingham University, and she's got over 15 years of experience in working in the field. And Dr. Martina McAuley is Research and Evaluation Officer at Housing Rights in Northern Ireland, and she's based in the Policy and Practice team responsible for carrying out research to inform policy as well as monitoring and evaluating housing rights projects. So those are our speakers, and thank you very much again to all of them. So I'm going to hand over now to Dr. Harris and Vicky to provide the first presentation. And as I say, do have a listen to what Vicky is presenting, and then do pose any questions for Vicky before she has to leave us. And then we'll hear again from Jennifer. Jennifer, over to you.
Thank you very much, Linda. I'm just going to share my screen a moment. So the effect of housing on health and well-being has really been brought into stark relief by the unequal impact of the pandemic However, even prior to COVID, there's been sort of recent research which has painted quite an alarming picture of the role of housing in widening health inequalities. So the recovery from the pandemic really offers us an opportunity not just to build back better, but really to build back fairer and to put the achievement of health and wellbeing right at the heart of government strategy. I recognise that the UK and devolved governments are at varying stages in their journey towards making this a reality. But what it does is raise questions about the impact of living in the PRS on well-being. Now, the concept of well-being is relatively new to housing research and is often quite narrowly understood in terms of satisfaction. Now, the Rent Better study, the Indigo House, the ongoing Indigo House research study, which is exploring the impact of the recent regulatory changes in Scotland, has showed in the interim report, the first report, that a significant number of tenants are satisfied with their house and services. Similar statistics are also frequently reported in the English housing survey. And I've been in quite a few meetings, events, presentations where these sort of satisfaction, these high levels of satisfaction, are sometimes interpreted as offering an indication of how well the sector is operating, and sometimes used as a means to sort of challenge calls for change in the sector. Now, however, what this perspective fails to recognise is something we call in academic research called adaptive attitude. Now, this is where people living in disadvantaged or marginalised situations sort of adapt their expectations to what they believe they can realistically achieve. So some people living in the PRS may report being satisfied because they don't know any better, or they don't expect to achieve any better, or the previous housing situation was significantly worse. So we need a more sort of nuanced, a more kind of comprehensive way of exploring well-being, something that really takes into account the multi-dimensional and complex nature of people's lives and the varying factors that do contribute to good well-being. And this is where sort of speaking to people can really add value. This study is informed by the capability approach. Now, this is a framework that offers us another way of thinking about well-being, and it's widely used in other fields such as education, technology. And it asks, so what are people able to do? Who are they able to be? Are they able to live a life that they value, to do the things that are important to them? And it's this body of theory that has pioneered the idea that we don't want to just sort of measure the success of a nation solely in GDP terms, but through a range of well-being measures. And this has proved quite influential with governments across the world, including those in Wales and Scotland, who have developed sort of national well-being sort of performance measurement frameworks. So Nussbaum is a philosopher, and he's sort of designed this one means of understanding the capability framework. And he's designed this quite famous list of 10 central capabilities. He says, these are 10 things that everybody needs in order to have good well-being. You can see it's not just about having good physical health. Yes, this is important, but it's also about having good emotional well-being, not feeling fearful and anxious all the time. It's about having good relationships with others. It's about being able to enjoy, recreational activities. So good well-being is so much more than the absence of an illness. Only a small proportion of people are ill. Well-being is something we all experience, and it's linked to our housing and neighbourhood. And in this table, we pull out just a few examples from the data, from our interview data, and I'll come back to talk about some of this later, which shows sort of how housing sort of either enhances or negatively impacts these key things that we all need to live well. The list is not exhaustive. There might be additional things, but the idea is that they're universal. So, and they're a little bit like human rights. So where somebody lacks these capabilities, the capability to have good emotional health, to have good physical health, to have good relationships with others, it's a matter of social injustice. So they're all important. You can't trade one off for the other. And it's also really important that people are forced to choose what we call capability deprivation. So by taking risks or trade-offs, and that's quite important. So I'll come back to that later. So we, as I said, we wanted to see how housing enhances or negatively impacts all these things, these essential things we all need to live well. We did that by sort of reviewing the literature, key themes from the literature. So a lot of what I'll talk about today is situated within a wider body of evidence, which we review in our first report. In our second report, we draw on findings from in-depth interviews we carried out with 53 tenants. We also spoke to sort of key professionals. We spoke to a range of people in varying income brackets. We wanted to explore not how housing not only negatively impacts what we need to live well, but also how it positively impacts it. So we spoke to people in different income brackets, different genders, different ages. And yeah, so that's the brief overview of the methods. And I just want to emphasize that we do not intend to sort of produce generalizable findings for the whole private rented sector, but to really provide a deeper understanding of the way housing affects well-being, something we go, as Linda mentioned, sort of add a little bit, go into a little bit more depth than what sort of statistics can tell us. So, and that's where, as I said, people's stories can really add value. So at this point, I would like to invite Vicky Card to come onto the screen, please. And she's very kindly offered to just share a few words with us about her experience of living in the PRS. Vicky, are you there?
Yep, hello. So I've been renting from private landlords for about 15 years now. I'm currently living in a rented flat. I've got one housemate. It's quite a small flat and we don't have any outdoor space. So the main criteria really for looking for this flat, which I moved into just before lockdown, was whether I could afford it on my wages. And so this is always like kind of a payoff between the location and the space of what I can afford. So yeah, so we found this place. It had 2 double bedrooms, which was important to me and my housemate, but it did mean we had to move quite far out of the centre and away from my friends that where I had been previously living. So with this, it's kind of like I lost that social support network. And also because of the pandemic, I travelled less on public transport. So I found it really difficult to meet up with people and I wasn't seeing people as much. So yeah, with the pandemic, I obviously was furloughed for a bit. I did blended working. So I was at home a lot, like most people. So I was spending a lot of time indoors and I share with a housemate. So we have a shared space and he has his kind of own mental health problems and addiction issues. So sometimes the atmosphere is quite tense here. So I was spending quite a lot of time in my bedroom, which kind of added to that isolation. So things that I would usually do to like kind of relieve that, or maybe without the pandemic wouldn't make it so obvious, was, you know, having outdoor space. I like being out in nature. That really helps my well-being, but I couldn't do that then. It was like restrictions on when I could go outside. I don't have my own private outdoor space. So that kind of negatively impacted me. I'm also an artist. I create artwork and I do have a like room for a desk in my room, but it meant I was doing like my work, my, you know, that I earn income from, and then my creative work in here, and then also using it as a space to sleep and just relax in. And, you know, my world became very small. It's still, you know, is a bit. I spend a lot of time in here. So yeah, so it's really hard when you don't have the divisions in between those different bits of your life to kind of get into the headspace to be productive. So my artwork, I had time, I was furloughed, but I didn't really do that much with it, just because I didn't have the motivation or inspiration to do it. And yeah, obviously living in a rented house, I don't decorate it the way I could. Like I'm aware that I want to get my deposit back at the end of it. So it's kind of, I make it as homely as I can, but it's not ideally how I'd want it to be the most inspiring place for me. The condition of the house is really important to like my well-being. When we moved into this property, the boiler didn't work, so we had no heating or hot water. And this went on for a little bit of time because the landlord wanted to come and fix it himself. And I don't think he was able to do that. So there was a lot of chasing and trying to find out what's going on. There wasn't great communication between the landlord and the letting agent and then us as tenants. And moving into a property is stressful in itself, but then not having that on top of it wasn't a very positive first experience with my interactions with my landlord or letting agent. And really that first interaction got worse as the pandemic went on, because my landlord would come around unannounced during full lockdown. And one occasion of this was letting himself into our property so he could paint the front door, and he didn't tell us, didn't even knock on the door to let us know we were doing it. We just woke up kind of to find him there. So yeah, it gives me the feeling that like this is very much his property. He can come and do what he wants, and I'm just paying rent here as like a temporary thing, which makes me feel quite powerless, really. It's like I don't, this isn't my home. And throughout all my rented properties that I've lived in, I really get that feeling of not, you know, this isn't my space. So yeah, and then on top of that, there's also that the kind of power that the landlord has to put up rent or like evict us. I've been evicted once because I think they wanted to sell the property. I don't really know why they evicted us, but yeah, so it's kind of like this, everything feels temporary and transient. And yeah, I'm currently in my mid-30s. So I'm kind of terrified that I'm going to be sharing for a long while yet. I can't afford to buy my own house. I can't afford to live on my own in a rented property. So at the moment, I'm just kind of finding somewhere, and because prices are so high at the moment, and they go so quickly, it's kind of like looking, hoping to find something better, but actually you kind of just take what you can because you're happy to have a roof over your head. And so yeah, I'm kind of in this cycle where I'm like moving into somewhere which isn't, maybe the conditions of the house ain't great, the housemates I don't get on with or I feel uncomfortable with, and then I stick it out for as long as I can there, and then I move on to another property, do the same there, and then like with this kind of idea that at some point in my future I'll be able to change my circumstances, but I can't really see that happening at the moment. So, and then like to do that as well, it's like this, you kind of, I had this idea of like, you know, that's the pinnacle, that's success. If you own your own house, that's kind of, you're doing well. And it's, yeah, kind of stuck in this cycle of renting and not feeling happy. And it also makes me feel like a bit of a failure, if I'm honest. So yeah, that's kind of a brief kind of outline of my last year in lockdown, renting. I don't know if anyone had any questions that they wanted to ask.
Thanks very much, Vicky. I think it's so important to hear people's lived experience, and also thank you for looking ahead to the longer term and the kinds of, you know, aspirations that you have and the challenges that you faced. I don't see any questions in the Q&A box. I'm just going to ask a quick question and then see whether any of the panelists wanted to. Oh, we have got a question coming up, sorry. Let me ask the Q&A box question, and thank you very much for Jill Robinson, who's posted this. She says, very interested in what Vicky had to say, thank you. Has Vicky ever been felt able to ask for a different type of tenancy in the PRS, more secure, longer term? What would her ideal scenario be in terms of housing home?
I haven't been offered a longer tenancy. It tends to be, in my experience, a year or 6 months, and then it goes on to a rolling contract after that. So I have, when I moved into this place, asked about a longer tenancy and they didn't want to do it. So yeah, my ideal, I mean, just being able to afford to live on my own in a rented house at the moment, that's like the next step up. So, but it's just too expensive, and I work full time. I should be able to afford it. Failing that, I guess, is trying to afford a studio space to do my artwork, just so I've got a divide. But again, it's the rent on them are quite expensive as well. So yeah, those are kind of like my immediate how I want to live.
Okay, that's really helpful. Thank you, Vicky. And I think that, again, those are really good aspirations. Everybody hopes that you'll get there. And I know that the market is really challenging at the moment. And Paddy Gray, I'll just ask Paddy's question and then we'll move back to Jennifer. Thanks, Paddy, for this question. He says, hi, Vicky, is there a renters voice group you can join? We have one in Northern Ireland.
Yeah, so I am part of like a Facebook group. It's like a kind of tenants association. And that's quite good, like an organization. Just for getting advice about like what I should be expecting from my landlord. If I'm unhappy with something, it's kind of good to, ask in that group, just so I've got like my peers to advise me. But that's kind of the only involvement I've had with like kind of that kind of thing. Yeah. That's it.
Yeah, I think those groups can be really important. I know that from other other topics that I've worked on. And can I just say, I think your example of the landlord turning up unannounced to paint the front door and letting himself into the property when you were there, I think is pretty shocking, actually. So I hope you don't have to experience things like that in the future. And I think the letting agents have got a big, role to play as well, which maybe doesn't come to the fore.
Yeah.
So that was really powerful from hearing from you, Vicky. So just to thank you very much. I know you've got limited time. So thank you again. I'm going to hand back to Jennifer now. Thanks.
Okay, great.
Thank you so much, Vicky, for sharing your experience. I really appreciate it. I'm just getting my slides back up. So what did our findings show? In a nutshell, some people do experience the PRS as capability enhancing. They had adequate space, the property was in good condition, they had positive relationships with the landlords, as they were able to engage in those different activities that contribute to good well-being. Some people living in the PRS, especially those on low income, experience capability deprivation. So if I go back to those capabilities, particularly people on lower incomes, experience capability deprivation on multiple levels. So they lived in housing that was sort of, the physical condition was detrimental to the health. They weren't, able to enjoy positive relationships with others because they had to move to a location where they couldn't afford, such as what happened with Vicky. They weren't able to connect with plants, animals, and nature because they didn't have their own sort of private space. So if you want to look in more detail and how sort of living in the PRS sort of enhances or negatively impacts sort of these different capabilities, and what is it about those sort of the physical and the spatial and the relational aspects of housing that does that, then I would point you to a report which has just been published on our website today. Today, what I want to focus on today is two sort of interconnected themes that emerged from our data. So the first is this idea of place, space, and belonging. Now, sort of people's ability to achieve all these key things that we need in order to live well varied across different spatial scales. So the interview suggests a high degree of place attachment. So the people were really attached to areas depending on sort of the availability of family and friends nearby, easy access to health services, schools, transport services, having a short commute to work, and people's sort of ability to engage in activities to improve their health or to enhance other capabilities varied across different sort of physical and social dimensions of space. So I'll give you an example of this. This was an individual that I spoke to in Scotland, and she says sort of she suffered with a chronic illness, and she said she had her Dharma center, 5 minutes walk. She had her the hospital, her health services nearby. She had an allotment nearby. All the things I've created, all the things I've invested in, my holistic support network is all within walking distance, so it's really accessible. So for this particular individual's ability to enhance health-related capabilities was very much attached to place. People's having adequate interior and outdoor space, so assumed particular importance during COVID. And again, this affected people's ability to engage in health-promoting activities. So there was a clear divide between participants that were able to improve or maintain their physical fitness by enjoying home-based exercise and reappropriating space for different purposes. So this first participant says, the living room, she does yoga and Tai Chi and all these different things. The living room becomes a disco, a dance floor, an exercise space, and she's able to reappropriate her living environment for these different purposes. So there was a divide between participants that were able to do that. And again, this was also replicated in the availability of outdoor space and those that lacked that space. So as this second quote, this other participant mentioned, I'd like to have a running machine, but you just didn't have the space. So it ends up watching telly and crawling the walls, as you can see cited in that particular quote. And as I mentioned, its space is related to health-related capabilities, but also about sort of relationships, being able to have people over, not being embarrassed about the state of the house, having space so you're not on top of each other when you're living with other people in shared living environments or with your immediate family. So space was particularly important in achieving lots of different capabilities. I just want you to keep this idea of place attachment in your mind as I talk about the second key theme. So this idea so when we're talking about what we all need to well-being, if you remember that list I showed you, one of them was emotions, having good emotional well-being, not being blighted by anxiety or negative emotions is key to living life well. So reflecting commonly sort of quite widely cited statistics about the number of tenancies that are ended by landlords rather than tenants is another statistics I hear a lot. It's, most statistics are ended by tenants rather than landlords. And indeed that was reflected within our interview data. So direct experiences of eviction, illegal or legal eviction, were quite rare. However, so enacted housing precarity, actual experiences of eviction were, however, this perceived risk of housing precarity, the fear of not being able to remain within the property was shared by a large number of participants. And interestingly, not just tenants that were living on a low income. It was for people in a range of different circumstances, including those that seemed to be relatively secure if they were renting from family or friends, for example, or higher income, expressed feelings of insecurity. And so this idea of perceptual insecurity, the fear of not being able to remain in the home, impacts emotional well-being regardless of whether it happens or not. So people talked about feeling stressed, feeling anxious, feeling worried. Quite a few people say it's always at the back of your mind. And actually there's other research that shows that has had to understand the impact of flooding on mental health, and the negative psychological and psychiatric impact of flooding has been shown in flood-prone areas regardless of whether the flood happens or not. So that's kind of, similar sort of observations here. And these worries were associated with their ability to maintain other capabilities, particularly those related with attachments to place. So people worried if I had to leave, would I lose the sense of safety? Sense of safety was tied in areas, familiarity with areas and knowing your neighbors and so forth. Would I lose a sense of safety? Would I lose the social connections? Would I, lose, what about my kids who are in school? So they worried about losing those connections that were related to place. And some worried about their ability to engage in relationships that, are supportive in different ways. And for this particular individual was supportive in terms of managing her mental health illness. So she talks about suffering with panic attacks and having her brother nearby. And she worried if she moved away from the area, that would make it worse, because she knows now if she, in the middle of the night or something, her brother is just down the road. He could pop round. So she worried if she had to move away, her capability to enjoy those relationships, which were important for her health and well-being, would be jeopardized, right? So leading on from there, this perceptual insecurity, this feeling of insecurity led to certain behaviors and choices, right? So several tenants expressed a reluctance to ask landlords sorry, there's loads of noise out here. A reluctance to ask landlords to complete repairs. And it wasn't always a question of them being afraid that the landlord would then evict them, this idea of retaliatory eviction. We know some tenants do face that risk. But it was, for example, if they worried that the landlords might not have the money to make the repairs. And there was a lot of assessment going on about landlord situations, or how old are their kids? Will they need a property soon? So it was interesting, like the assessment of landlords' personal circumstances really fed into their feelings of security. So, but ironically, where people didn't request repairs, this would negatively impact their ability to improve other capabilities. For example, improve physical health by living in a house that doesn't have lots of disrepair. So what our findings suggest is that for some people living in the PRS, renting is a process of sort of risk negotiation. People weigh up the probability of being able to maintain the different things, the different capabilities that are important for well-being. So they talked about, if they did find a house where they were able to personalize the space, as Vicky mentioned, being able to personalize the space was really important to participants. It was really key to achieving a sense of home. So some people said the risk of losing the autonomy that they achieved in a property where they had that freedom, if they had to move, or where they didn't have the same freedom, or the risk of jeopardizing the positive relationship with the landlord in that property if they moved to another one. And this really affected people's willingness to assert their legal rights, to ask for repairs, to ask for a renewed tenancy agreement, or put forward other requests that might enhance their well-being, such as asking for permission to keep a pet and having that connection to nature. And sometimes there was some, again, this ties back to my earlier sort of point about satisfaction. Sometimes people reported being satisfied with the property because the past situations were much worse. One individual who lived in a house with a rat infestation and a broken shower and violent threats from neighbors said, well, actually, it's not too bad because where I live was much worse, And sometimes people achieved certain capabilities. They lived in the area where they wanted, so they had those social connections. So they reported being satisfied, but this was at the expense of other capabilities. So for example, living in a house that had physical disrepair and that affected their physical and or mental health. So there was this trade-off between different capabilities. And if you remember, they're all important. And this quote just is about sort of this idea of sort of negotiation trade-off. If you're living in a condition that needs to be addressed, your health, do I do it? Do I complain, or do I rock the boat, or do I live in a bad situation that will affect my health? And these kind of negotiations seem to be a part of renting for some tenants. So what affected feelings of housing precarity? So yes, tenancy terms, the ease of which your short-term contracts in England, the risk of no fault eviction, that seemed to play a role. There was a few participants in Scotland who did mention sort of changes to recent tenancy law, and that seemed to make them slightly more secure, but that was just a few. What our findings suggest that actually these legal frameworks only contribute to feelings of these perceptions of security to a certain degree. They play a role, but actually what seemed to be particularly important was the relationship with the landlord and how positive or negative that was, what reassurances the landlord gave, the assessment of the landlord's circumstances and so forth. Additional factors was barriers to accessing the PRS, the length of time that they spent in the property, and familiarity with the area. So there's lots of other factors that contribute to how secure or insecure people feel. And this first quote demonstrates that, my partner is a bit of a worried. He's worried we're going to get chucked out on the streets. There's a lot of competition, knocks your confidence when you're trying to get a place. And he's like, it's such a nightmare. We can't get into anywhere. How are we going to stay anywhere? In certain areas of high housing demand and lots of competition, some tenants express sort of a sense of gratitude to have a house in the first place. And again, the second quote just demonstrates this. When I've been somewhere a while and I have a good relationship with my landlord, that's what helps me to feel secure. So I realize I'm running out of time on my last theme, and I'll just be a few minutes. So relationship with the landlord. So this was absolutely, it was really interesting. The two things that tenants talked about the most was feelings of security or insecurity and the relationship with the landlord, regardless of the sort of situation that they were in. Almost everyone talked about the relationship with the landlord. That really hit me. And it was really fundamental to achieving a wide range of capability, control over your environment. Remember Vicky saying the sense of powerlessness, because the landlord comes around unannounced. And I should mention that not everybody had negative experiences. Some people spoke very positively about their landlords. They were good at communicating, they were responsive, but others, they were timely in responding to repairs, but others, that relationship was more difficult, and that constrained their ability to achieve key capabilities. And just quickly, so some people talked about their experiences of poor conditions or less than professional services, but they were worried if we express our concerns, we might end up in an even worse situation. So there was lots of this idea of fear of the imagined alternative. So not just from their direct experiences, but from stories from the media, from stories from family and friends. So some people talked about sort of being lucky to have a positive relationship with the landlord, and were worried about if they moved, what it might look like. So my final slide, just a final few reflections. So the number of tenancies terminated by landlords is not an adequate measure of the experience of housing insecurity or insecurity. Perceived feelings of insecurity affect well-being regardless, and they affect housing choices and options regardless of whether eviction actually occurs. Secondly, satisfaction statistics do not by themselves provide an adequate measure of well-being, nor how well the sector is operating. The third point I want to make is changes to the tenancy law, absolutely important. In our report, we make a range of recommendations. We recommend that the UK government sort of honours its pledge to end no-fault evictions in the PRS, but it's not. We would say it's the beginning of the journey. It's not the end of the journey towards improving the sector. Training and advice for landlords and tenants must be seen as part of the regulatory architecture of the sector. And finally, I would just say what the findings suggest is really we need to rethink the type of society we want as society. It's not just about having housing that's free of physical hazards, but it's where people can feel safe and secure, connect with loved ones, and fulfill all those different things that we all need in order to live well. So I'm going to finish up there, but as I said, I'd point you towards our report if you want to see some of the recommendations that came out of that. So thank you.
Thank you very much, Jennifer. That was very comprehensive, and I know we've had a question or two, so look forward to discussing those in the panel. So I'll hand over now to Michael Tornow, who has said before was from Public Health Scotland. So thank you, Michael. Over to you to speak about how healthy is housing in Scotland.
Thank you very much, Linda. Just so everybody knows, I'm reading the presentation from Braille, so there might be a couple of delays sometime. I am a Senior Health Improvement Officer at Public Health Scotland, and we published last month Healthy Housing for Scotland, which is a briefing paper which sets out the mechanisms and pathways that between housing and how it influences health and well-being. It's intended to influence implementation of flagship housing policy the Scottish Government has published, which is called Housing to 2040, which is a vision and route map for what housing should look like in 20 years' time. The paper covers several priority themes: affordability, accessibility, house conditions, low carbon, energy efficiency, and climate change, climate resilience, rather. It also includes a focus on marginalised communities, homelessness, mental health, and place and community. And what it's done is it's picked up any evidence or research that's been published in the public domain. So in the next sort of few minutes, I'll outline a couple of the key points in the paper, particularly where they relate to the private rental sector. There are a range of ways in which housing can be modified, which will make for healthy outcomes for households. These include improved energy efficiency of the home, removing hazards, making housing accessible for people with disabilities, and including the provision of affordable housing. There are estimates in terms of the quality of housing. There are estimates that poor quality housing has an impact on the health service, and while estimates vary, the risk to health and housing, the risk to health and provision of treatment could likely be avoided if the quality of housing was improved. The provision of housing, apologies, the housing tenure in Scotland has changed over years. So in 1999, 5% of households lived in the private rental sector. That by 2018 had risen to 14%. And we know that across the Central Belt, in particular Scotland, rents are less affordable in the sector. Poverty is a key determinant of health inequalities, and living in poverty is damaging for health, and it's certainly one of the causes of inequality. In terms of income, low-income households are more likely to be living in and be impacted by fuel poverty, and this is damaging for health because we know that cold and damp homes are associated with higher levels of mortality and cold-related illnesses. Fuel poverty can cause stress and anxiety for households due to worrying about bills or debt. It can result in choices between heating your home or eating, or only being able to heat part of a home, which leads to stress and anxiety and isolation. Fuel poverty is not specific to the private rental sector. All housing tenures experience it, but in 2019, within the PRS sector, 36% of households were living in fuel poverty. which is actually quite similar to other tenures. It's only owner-occupiers that are significantly less so are living in fuel poverty. Research carried out before a pandemic identified that many private rented sector tenants are actually unaware of their legal rights. So in Scotland, that is the private residential tenancy agreement, and being able to take your hold your landlord's account at the first year tribunal. There are also research has also found that changes are needed to improve the provision of advice to private rented sector tenants, so that the different forms of advice and various options of advice to resolve problems are offered. And this is concluded that this is key to raising standards in the sector overall. As Jenny has been saying, a good tenant-landlord relationship is really key. It's positive for tenants' well-being and for tenancy sustainment, as is landlords and agents enabling their tenants to make their house a home and make choices about it. Other research has also found that all homes, irrespective of tenure, should have access to outdoor space, broadband, and daylight. We know that during lockdown, and as we've heard this morning, we know that access to outdoor space has become increasingly important. And research that was carried out during the pandemic identified that people in homes with access to outdoor space were most comfortable, and those with no outdoor space at all were least comfortable with their homes. This is quite important because in Scotland, it's estimated that 13% of households have no access to outdoor space at all. And recent UK-wide research that Public Health Scotland's been involved in identified that the private rented sector is least likely to have any outdoor space. And we actually found that 23% of private rented sector tenants that participated in research had none. So just to conclude, we know that from sort of reviewing all this research that there are some questions that haven't been addressed. We would particularly want to try and strengthen evidence between causal evidence between availability of outdoor space and health and well-being. We would want to know more about the impact of energy efficiency measures on health and well-being. We would want to know how measures to adapt housing to prepare it for climate change, and what impact that has on health and inequality. We would like to know more about the impact that poor quality housing has on health and well-being, and the impact that insecure and inaccessible housing has for tenants. And lastly, and in some ways, most importantly, we would want to ask how current policy and practice in the housing sector, how that can impact on how we realise the right to adequate housing. And I'll hand back to Linda.
Thank you very much, Michael. Again, that was very clear, and I certainly raised some questions for me, which we can discuss in the panel. If you've got any questions for Michael, do pop them please in the Q&A. So I'll hand over now to Joanna Seymour, who's project manager from Warm Wales, and she's going to be talking about the Healthy Homes, Healthy People, tackling fuel poverty, reducing avoidable health inequalities, and improving health and well-being for residents in North Wales. So over to you, Joanna. Thank you.
Thanks very much. Okay, I'm just going to share my screen. Okay, so I'm mindful of timings. So yes, thank you very much for the invite to be part of this launch event. I'm Jo Seymour, I'm project manager for Warm Wales. and I'm an environmental health practitioner with 16 years experience working in housing and public health. Every property in Wales that is rented on an assured short hold tenancy needs to be registered with Rent Smart Wales, and anyone managing a rented property needs to have a licence to do so. From the information that we've heard, we know that lots of the most vulnerable are living in the private rented sector, as they cannot access social housing, let alone get on to the property ladder. In order to improve someone's health outcomes, we need to tackle the root causes, and we also need to understand the wider impacts our home have on our health and well-being. And this has become even more apparent during the past year. This slide just shows some of the wider impacts poor, unsuitable housing can have. Warm Wales is a community interest company established back in 2004 with the aim to provide homes with affordable warmth and to alleviate fuel poverty across the country. One of the projects that we deliver is Healthy Homes, Healthy People. Healthy Homes, Healthy People support residents to have warmer homes, safer homes and healthier homes by offering a range of advice and support and referrals tailored to the needs of the residents. From 2018 until the spring 2021, we've surveyed just over 3,000 households and delivered more than £2.4 million worth of savings. And in North Wales, that's broken down to just over 1,300 surveys and just over £1 million worth of savings, which is an average of £788 per household. During my time at Warm Wales, and with my background as an environmental health practitioner working in the private rented sector, and all of the information that you have heard this morning, we knew that we needed to do more and that we could do more. So we then came up with the enhanced version of Healthy Homes, Healthy People, which looks to take residents out of fuel poverty, reduce avoidable health inequality, and improve their health and well-being by meeting residents' basic needs so they can go on and fulfill their full potential through engagement, education, encouragement, and empowerment to ensure that everyone has access to safe, sound, secure housing where they can grow, work, and play in. We take a holistic, person-centred approach, looking at all the areas so that we can provide wider support from the community, and also looking at social prescribing. On the screen, you can see the sort of support that we provide, where we provide that support, and where we can get our referrals from. In order to be able to get referrals, we came up with these 4 questions that you can see on the screen. And we use these questions and we get the referrals from frontline practitioners, such as those working in the Flying Start team, health visitors, support workers, GPs, occupational therapists, housing officers, environmental health officers, welfare officers. And these questions are also used in order to be able to collect feedback from the resident once we've provided that support. On the screen, you'll see some data that we've collected over the past year with regards to the referrals that we've received. And the sections that are in blue are from those residents within the private rented sector. And you can see those individuals living in the private rented sector are struggling to manage their money. They're struggling to keep their home warm, the home's cold, their health is being impacted by their home. So all of these things we then use as a way of being able to record feedback from the residents. But as we've been saying, just asking questions isn't necessarily enough to identify whether or not we've had an improvement on people's health and well-being. So what we've done is we've started using a case management system which looks at health and well-being using a score, using ONS4, which is personal well-being. This is collected by the Office of National Statistics. And what's really, really handy is that because this is collected by the Office of National Statistics, we are able to look and compare our results with the residents that we are providing support to from a local, regional and national basis. So we ask questions looking at happiness and anxiety, looking at life satisfaction, worthwhile. And obviously some of the questions that you can use, say SwemWeb, can be a bit intrusive. And obviously, if you're providing support to somebody who is already feeling quite vulnerable, their mental health is quite low, those questions can be a bit intrusive. And we found that using these questions is a good way of being able to collect data before and after the support to see whether or not there have been improvements with their health and wellbeing scores. And obviously what we want to be able to do is not just collect information and data on improvements of whether or not we've taken somebody out of fuel poverty, whether or not we've saved somebody money on being able to install a new heating system because their heating is broken. We want to be able to demonstrate the wider impacts that we've had on being able to get somebody out of their property, get somebody back into activities so that they're not as isolated as they were, being able to get somebody into a cooking class. So it's about those wider impacts that we can have with the support that we provide through Healthy Homes, Healthy People. And finally, on the screen, you'll be able to see some scores from data that we've collected, again, over the past year. So at the beginning of the support that we provided back in April, you can see from an anxiety point of view, people's anxiety levels were relatively high. Everything that was going on from a COVID point of view, but also those impacted with not being able to pay their energy bills, not being able to access food, so not being able to meet their basic needs. And then again, you can then see that those anxiety levels have reduced over time with the support that we've provided. And again, you can see the levels of satisfaction, worthwhile, and happiness. Thank you.
Thank you very much, Jo. That was very clear and also really interesting to see some of the data that you've collected there. That's great. So, sorry, let me switch my camera on. So colleagues, do pop your questions in the Q&A box. I think we might have one in the chat. If you can pop that in the Q&A, that would be great. Right, so really pleased now to hand over to our next speaker, who is Martina McAuley. So she's Research and Evaluation Coordinator, as I mentioned earlier, for Housing Rights. And she's going to talk about housing rights PRS clients' well-being, evidence from their research in Northern Ireland. Over to you, Martina.
Thanks very much. I'm going to try and share my screen here, so hopefully you'll be able to see that okay.
Yeah.
Okay, super. So thanks very much for the opportunity to talk to you today. I'm going to talk about some of the research that we've carried out at Housing Rights. I'm part of the policy team at Housing Rights. So our policy work is based on the views and experience of the people who contact us for advice. And my research is used internally and externally to inform the policy work that we do. And it can be anything from back of the envelope calculations, providing stats and other data to support our policy positions, to full research and impact reports. So to date, my research focus has been on the private rented sector in Northern Ireland, which has grown at around the same rate as the other parts of the UK. And we know that the sector is now housing an increasing proportion of families, particularly single parent households. And our research has shown that there are more lower income households competing for fewer properties to let at the lower end of the rental market, where prices have increased disproportionately compared to the mid and higher end of the market. So for example, the proportion of households with children living in the private rented sector has increased substantially since 2003. Whilst the proportion of households with 2 adults and children who live in social housing has remained fairly constant, between 7 and 10% since 2003, the proportion of households living in the private rented sector of this type has more than trebled. The proportion of single parent households living in the private rented sector has seen the largest increase in the past 2 decades. Over half of all single parent households were living in social housing in 2003, but by 2019, this had decreased to around 1/3. There was a corresponding increase in the proportion of single parent households living in the private rented sector from 23% in 2003 to 45% in 2019. So what does all that have to do with well-being? Well, in the private rented sector households, in Northern Ireland, that accounts for around 1 in 5 households. They're disproportionately represented, though, in terms of housing rights clients. So around 1/3 of our clients live in private rented sector accommodation, and the most prevalent issues they have concern affordability and property conditions, both of which impact negatively on well-being by increasing stress and the corresponding negative emotions associated with that. So we know that poverty impacts significantly on well-being. Recent research in Northern Ireland carried out by the Housing Executive show that when we compare like with like, for example, looking only at households in receipt of state support to pay for their housing, we can see that there's a higher proportion of households of this kind in the private rented sector, which were considered to be living in poverty. And this reminds us that it's important not to look at the private rented sector as a whole, because private tenants are not a homogenous group, because it includes households living in luxury accommodation, as well as households which have to rely on state support to pay for their housing. The private rented sector works really well for many people, but when it doesn't, it has a real impact on well-being. Our research on accessing and sustaining tenancies in the private rented sector highlighted the nature of the affordability issues that our clients were facing when trying to access accommodation in the private rented sector, and also the impact of precarious employment or being on benefits that had on their ability to secure rental property. But they also faced issues in sustaining their tenancies. So it's one thing to be able to get into a property, but if you can't afford to pay the rent and you end up in arrears, there's a good chance that you'll end up being evicted and presenting as homeless. But looking at the cost of living in the private rented sector was also important. So it's not just about being able to afford to pay the rent, but many of our clients who have affordability issues are also impacted by the standard of accommodation that they can get access to, often finding that the property is impossible to heat or just too expensive to maintain a reasonable degree of comfort because of old or inefficient heating systems. And to be clear, our current fitness standard in Northern Ireland means that a property would meet the fitness standard in regard to heating a property, so long as it has a plug into which a heater can be plugged into. So in subsequent research, we found the potential to discharge the homeless duty to the private rented sector impacted on our clients as well. So housing rights advisors raised concerns in this research relating to security of tenure, support for tenants as well, and control over their environment. For example, issues which were specific to young families living in the private rented sector, such as the need to remain close to schools and caregivers, and those kind of things really restrict their options for moving. While some private tenants will undoubtedly prefer relatively short contracts, there are others who would benefit from the security that an indefinite contract would provide. Even the issue of landlords who are reluctant to allow pets into their properties was something that effectively reduced the options for some households, leaving them with fewer properties which they could access. So these issues impact on feelings of autonomy and control for private renters who are affected by them. For clients who are impacted by poor mental health, the advisors raised issues around the differences in provision for services for social and private tenants, because in social housing there's proactive engagement with tenants, including referrals to support agencies. But that's not necessarily the case for clients who can't get into social housing and end up renting in the private rented sector. It's understandable that landlords or their agents may be reluctant to engage in any kind of support for their tenants, and this is a really important point to stress. Private landlords are understandably concerned to maintain full occupancy of their properties, and they're not operating a charitable service. In addition, clients renting from landlords or their agents who have poor property management practices can end up having very negative experiences. For example, not getting essential repairs carried out in a timely fashion, or sometimes not at all, which enhances their feelings of lack of control for tenants. While some tenants undoubtedly appreciate not having repairing obligations, for others, not being allowed to do repairs themselves or to even hang pictures or operate a small home business, that can enhance feelings around lack of control over their environment. So our research on the impact of COVID on private renters used evidence from our case records spanning 4 months in 2020 and shows that our private rented sector clients were disproportionately affected by issues arising from the pandemic and lockdown. They were caught in the perfect storm of low incomes, often as a result of job losses, furlough or reduced hours as a result of the pandemic, job insecurity, pre-pandemic as well as during the pandemic, and tenure insecurity. So almost half of those who had affordability issues were fearful of being evicted as a result of the arrears they were accruing. A high proportion of those affected worked in hospitality or were self-employed. For those facing eviction in the early stages of the pandemic, with few, if any, options for moving, this was a really stressful time. Many people were applying for benefits for the first time in their lives at this time, and clients reported finding the system difficult to navigate. Particular elements of the system, such as the 5-week wait for universal credit payment, were difficult to cope with, adding to their stress. The support provided for many employees and the self-employed was indeed a lifeline during this time, but it's important to remember that it didn't reach everyone affected. For those who fell through the cracks, the past 18 months have been nothing short of life-changing. We hope that the research helped to shine a light on systemic issues affecting low-income private renters and to bring attention to the point that we didn't all experience the pandemic in the same way. We were not all affected in the same way, and perhaps more importantly, we didn't all go into the pandemic in an equal position. We might all be in the same storm, but we definitely are not in the same boat. Whilst none of the research I've undertaken so far has looked specifically at well-being in the private rented sector, it is an underlying theme across all of the research. In addition, our own client survey results show that for private rented sector tenants who contacted Housing Rights, the advice, advocacy and representation which Housing Rights has provided has an impact on our clients' sense of well-being. Asked in all surveys across all of the various projects which Housing Rights run, over 80% of clients felt that their well-being had improved as a result of contacting Housing Rights. And in the context of a challenging private rented sector experience for many of our clients, this is something that we're very pleased to hear. Thank you. I'll stop sharing my screen now.
Thank you very much. That was excellent, Martina. And I think it's really useful in this webinar just to have these perspectives from around the UK, because the issues are common, many of them, but the devolved nations often within the regulatory and policy framework have different approaches, as we've heard. Fantastic. If anyone's got any points that emerge from Martina's presentation, do please put those in the Q&A. So if I could ask all our speakers now, including Kim as well, who's going to very kindly assist us with this discussion, just to switch on their cameras, that would be brilliant. Let me just get the questions. There we go. Thank you. Okay, so what we're going to do now, colleagues, and thanks for those of you that are able to stay for this Q&A panel, we're just going to have a general discussion over some of the themes that have emerged and also pose the questions. We've had 5 or 6 excellent questions in the Q&A box. I will go through each of those for the speakers, but I just want to hand over to Kim first to see if there's any general comments or points she wants to make in relation to the report or on the back of any of those presentations. Kim, anything you just want to add before I pose the questions from attendees?
Thank you. I think Jennifer did an excellent summary of our report and the time that we had, and I think it was really valuable to hear from Vicky's experience, because I think that probably brings out the themes emerging from our research in a much more powerful way than perhaps we can do justice in the time we have. So just to say thank you very much for Vicky for joining us today. We really appreciate that. And I think what I would add as well is that, you know, Vicky's experience in many ways wasn't unique. Many of the themes she was talking about were also echoed by many of our other participants, and in previous projects on the private rented sector, both Jennifer and I have been involved in. So I think there's a lot of recurrent themes that we're seeing now in the body of work that's grown on the private rented sector. But I think this particular study also highlights some new dimensions and also some further gaps for research as well that we can follow up on, and maybe that's something we can explore in the panel session.
Excellent. Thank you very much, Kim, and thanks for your contribution to the work as well. So I'm just going to go through some of the general points that have been raised here. So we'll start off with some questions for you, Jennifer, and maybe you want to refer back as well to Vicky's experience. So this is from an anonymous attendee, but just saying some of the things mentioned, precarity and cost, are more clearly linked to tenure. Others, some of the things mentioned in the report, indoor space, outdoor space, neighborhood and place, maybe less so. So how much is tenure per se the driver of well-being? So maybe Jennifer, if you start, and then Kim might have something she wants to add.
I think I'm going to let Kim take that one. We're joint authors on the report, so we're going.
Fantastic. Over to you, Kim.
Okay, then that's a really good question, and it is a complex issue, that's sure. There's some aspects of well-being that you can see in terms of the size and design of properties that are kind of there regardless of tenure. So things like space standards, accessibility of the property condition. But I think what our data also shows is that there are particular private rented sector effects, and there's 3 things I would highlight here. Firstly is the relational aspect, that relationship between the tenant and the landlord that came through very strongly in our qualitative data, and I think Vicky brought this out very clearly as well. And that's a very different relationship to what tenants and landlords tend to have in the social housing sector, and partly that's due to the nature of the tenancy and also due to the structure of the private rented sector that we have in the UK, which is geared around small landlordism. So I think the relational aspect is quite unique. The second thing I would say is, the nature of the tenancy is really important in terms of security of tenure, and of course that varies across the UK. And this is not just about how long people can stay in the property legally. There's also things like restrictions on being able to personalise the property, being able to keep pets. That's something that's coming through much more frequently in studies we've been involved in. Some landlords don't like children being in the property and have restrictions around that, which impacts families. We've certainly had participants in past projects who've been asked to leave when they're pregnant because landlords don't want children in the property. And that's a big issue, as more and more families with kids are renting privately. And the final thing is that, coming back to the physical dimensions of the property and how that impacts on well-being, conditions do tend to be poorer in the PRS than in other tenures. Property is less energy efficient, generally poorer conditions. There can be more overcrowding, more sharings because of HMOs, so space is under pressure. So I think there are kind of, you can see themes across tenures in terms of design and size, but I think there's also unique dimensions to the private rented sector, and hopefully when you have a chance to read the full report, that'll come out quite clear from our study.
Thank you very much, Kim. That's really helpful. And I know as well, with the landlord's perspective is really important. And we have Tony, who's joined us, who's a small landlord in the Portsmouth area, and he's made some comments in the Q&A, which I'll come to later on. But also just to highlight that Paddy has highlighted in the chat. I assume, Paddy, this is from the Republic of Ireland, just to let everyone know that the Residential Tenancies Board, yes, in ROI, has just published cutting-edge research on tenants, small and medium and large portfolio landlords and letting agents. And he's put the URL in the chat. Also, Gareth very helpfully provided a link to the report that Michael was discussing. So I've got a couple of questions for you, Michael. I'll maybe put those two questions together, and if you are able to address them, that would be really helpful. So the first one was, in your opinion, is the Scottish Government thinking to start implementing the RPZ? What have been the barriers and challenges that have led to the delays? So that's the first question. And then the second question from Carolyn Hurst, interested to hear about what more could be done to ensure that housing is central to the health and social care work of integrated joint boards in Scotland. And she knows that we've been having the IJB housing contribution statements, but the PRS does not seem to feature in these. So a series of questions there. Is the Scottish Government thinking of starting implementing the RPZ? What are the barriers and challenges? And then from Carolyn, what about the integrated joint boards in Scotland and the extent to which housing is really on their agenda? Thanks, Michael.
It's probably more opinion rather than evidence that we have, because in terms of the first question, can I just clarify, is that rent pressure zones that the question asked about?
Yes, well,
yes,
not
yes,
being
yes,
an expert in the field, I assume that's what RPZ is. Yes.
Yeah. So the problem with rent pressure zones is that the legislation that was introduced in 2016 around the private rented sector tenancy, while it allowed local authorities to apply to have rent pressure zones, it seems that the methodology that's required for one to be successfully applied for makes it very, very difficult. Now, in Housing to 2040, one of the actions that the government has published is, I think it's next year, they plan to publish a rented sector strategy. And I mean, that's not just for the PRS, it's for all renters. And it certainly would be my expectation that that will look at potential reforms there might be to rent pressure zones to make them, I suppose, it's a meaningful option for applications to be made. Because we know that in Edinburgh, certainly Glasgow, other parts of the Central Belt, rents are really unaffordable and have increased in recent years significantly, and particularly unaffordable in Edinburgh and Central Glasgow. The other questions, in terms of health and social care, the housing contribution statements should address all tenures. We know that there is quite a big disparity between the publication of housing contribution statements. So in some local authorities, the housing contribution statement is embedded and integral to the strategic plan, which is sort of shared between the health and social care partnership and local authority and the NHS. but in many local authorities, that's not the case. It's either a standalone document that isn't really integral, or it's just not there at all in some cases. I don't really have anything else to say about that, other than we know that there is now a need for new housing contribution statements to be published, because there's a sort of 4-year cycle that they go through. So it will be interesting to see now that the kind of structures have matured a little bit, what differences there are. If I've not addressed the third question, please let me know.
No, I think that's really helpful. Thank you very much. And just a comment here from Gavin in the chat. He says, in terms of the rent pressure zones, 2 potential issues. Data requirements are currently undeliverable, and the case has to be made to ministers rather than being determined by the local authority itself. I don't know whether you've got views on that, Michael.
Just that. What we know is it's very, very difficult for anyone, be it renters, be it local authorities themselves, to try and I mean, we haven't any example since the legislation was introduced of a rent pressure zone being created, and we know there's probably need for it. So I think the government do recognise that, and hopefully the strategy that I referred to earlier will make that a meaningful and easier thing to apply for.
Great. And just a final question from me, Michael, to you before I pose a question to Joe, which I think is an important one, and then move on to the other speakers. Obviously, in Scotland, we're looking ahead to post-pandemic recovery. And as you know, that's the brief that the Deputy First Minister has been given, and there will be a new parliamentary committee on that. So in terms of Public Health Scotland, to what extent do you think housing is going to feature in those efforts? And do you think that it's already being taken seriously enough, given the lessons of the last 15, 16 months and the experience we've heard from all the speakers about how tenants have had really challenging situations, particularly during the pandemic, but based on long-standing inequalities? Any comments on that?
Yeah, so I probably haven't touched on this very much in my presentation, but certainly in the briefing paper itself, there's quite a lot of detail about health and the social determinants of health, and lots of things that have an impact on people's health and well-being are out with the control of health services. So employment, poverty, housing are all determinants of how healthy we are, and that's certainly something that we recognise in Public Health Scotland, and one of our priorities is to support healthy and vibrant places, and housing is a integral component of our place. In terms of the wider aspect of recovery, in Scotland, there is a group that was formed during the pandemic, which is called Private Rented Sector Resilience Group, which is a group that's the government has been involved in, but also Public Health Scotland, Citizens Advice Service in Scotland, Shelter have all been part of that group, and that has looked at various aspects of support for private rented sector tenants, and so I mean that has focused on things like introducing a loan scheme for tenants in particular circumstances. It's produced a toolkit, a resource which we have published online, but also in hard copy, and that was explaining to private rented sector tenants what new rights were that they had since the pandemic legislation, to have as much choice and control as possible in their circumstances, and we agreed a set of pre-action requirements that landlords have to go through before they can evict a tenant. So yeah, but there's a range of things that have been done in Scotland to try and sustain people in their homes as far as possible.
Really helpful. Thank you very much, Michael. So Joe, thanks again for the excellent presentation, and also really interesting to see some of the methods you'd used in the research. So I had a question, and then also there's a question from Siobhan McGrath, which is in relation to Scotland, but I'd be interested in the experience in Wales. So just thinking about the anxiety levels that you presented there and the comparisons with the ONS data, and as you know, there are a number of data sets that have been bespoke data sets during the pandemic, looking at levels of anxiety and depression in the general population, which have gone up on average by about 14% from pre-pandemic across the whole UK population. And you also showed that the anxiety levels had improved. So I guess my question is, did they become worse during the pandemic period? Was that the case? And then do you think some of the interventions that Warm Wales was recommending and the support networks, etc., actually managed to address those levels of anxiety in that sample?
Yeah, I think, thank you very much for the question. I think, yeah, from an anxiety point of view, something that we did find is people were already anxious, you know, as in the presentations that we heard about where people were, they're not on level playing fields. So they were already struggling, you know, as in to deal with, you know, paying their energy bills, for example. Added to that, you've then got the issues with pandemic, somebody then being put on furlough. So then you're then struggling to actually afford what you couldn't afford in the first place. So, you know, as in people's anxiety levels, you know, as in we did see, you know, as in them, you know, as in sort of increasing and getting worse. But because of the support and, you know, sort of how we provide that support, it's all about having that initial conversation. So yes, they may come to us and say they're struggling to pay their energy bills, but actually we have that initial conversation with someone to actually find out what's going on. Where are they? What is their current situation? And because we do it in that way, it sort of puts people's mind at ease. It makes them realise that actually we are an organisation that does care. We're not all about, you know, as in tick boxes, is that we do actually care, we do want to listen, and we do want to be able to provide solutions and help those individuals get out of the situation that they're in. And, you know, as in I've got a lot more information, I could have spoken for a lot longer. I've got a lot of feedback, case studies from residents that have actually emphasised the impact that we have made on then being able to deal with things and actually being able to deal with things, you know, as in sort of going forwards. So it's been a little bit tricky to actually work out how much more impact that the pandemic has had, you know, on you know, some sort of anxiety levels and, you know, what impact, you know, as in our support has directly had, you know, as in sort of with them. And what's quite interesting is from the information, you know, as in that the other panelists have provided about looking at health and wellbeing and research, we're also doing a pilot on behalf of the Welsh Government, looking specifically at the provision of energy advice. And we are incorporating health and wellbeing, a bit more about social prescribing, behaviour change, and we'll be having an independent evaluation. So that form of, you know, research and evaluation and feedback might actually be of use, you know, as into the panelists, and also to further research about what we're doing, you know, as in Wales as well, with regards to health and wellbeing and linking it with housing, because that's definitely something that is important, you know, as in from a Welsh Government point of view.
Great, and just to ask you on Wales, and then I'll maybe hand over to the others if they've got any comments on this question from David Rundle, and then I will come to you, Martina, because I've got some questions for you. So David Rundle, Joe, has said, is there evidence on how much impact on well-being the devolved nation's rent arrears hardship funds have provided over the past 6 months? Is that something you've had in Wales?
It is, yes. So we have had, so I think it started off with a loan and now we have got a grant, you know, from a funding point of view, because obviously how we work in partnership with other local authorities, you know, looking at discretionary housing payments, so be able to, you know, provide any shortfall with regards to rent. And obviously, you know, as in the grants that have now been released for those individuals who aren't currently receiving universal credit as a payment to be able to pay their rent. So I think that definitely helps, and I think it has helped. I think obviously the issue that we have is that if somebody is struggling with their rent, they will be struggling with other things. So obviously what's really, really important is that you take that holistic nature, is that organisations work together to be able to look at not just paying their rent, but paying other things. And the biggest thing that we've identified is the issues that residents have been having with their utility providers and dealing with payments for gas and electric, because they have not been the most helpful.
Yeah, no, that's not, sadly not surprising, but that's very helpful. Any other comments from anyone else on the panel on the impacts of the rent arrears hardship funds? Anyone want to add anything? No? Okay, we'll maybe come back to that. There's other questions. So Martina, from Julie Rugg, she's asked, could you say a little bit more about the new applicants for housing benefit and the shortfalls they might be facing between the LHA and their contractual rent?
Yeah, so we know that as a result of the pandemic, the LHA rates, which that's what the support for private rented sectors tenants is based on, local housing allowance rates. And we know that they were increased to the 30th percentile, which sounded like great news. And it is fantastic to get that, to see that being implemented. But we do know that because of, particularly in Northern Ireland, we, no doubt it's the same in other places as well, because of the shortage of properties, the low number of properties that are available to let at local housing allowance rates, that most of the clients that we have that were getting their support for their housing in the private rented sector were not able to access properties that were that were able to be supported in full. And even if they could, as we found out from our research, they were sometimes in very poor condition. But we do know, we did one of those back of the envelope calculations to show that, in fact, whilst the shortfall, the average shortfall when the before the LHA rates were raised to the 30th percentile, the average shortfall for private rented sector tenants between the support they received and their contractual rent was around £28 per week. Our calculations showed that by increasing that to the 30th percentile, the LHA rates were increased. It still meant that there was a shortfall of around £18 per week. So there's still people in considerable difficulties, even with that increase to the 30th percentile. So it sounded like, you know, we'd all been crying for this to be instituted, and it was great when it was, but in actual fact, we've got a problem with the sufficiency of properties as well available at that level.
And just looking ahead as well in terms of Northern Ireland in the context for the post-pandemic recovery, what are your sort of key asks for government? I know that's quite a big question, but maybe just a couple of the issues.
Yeah, that's a really big question. But I suppose one of our key asks is, you know, to have that kind of indefinite tenancy for private rented sector tenants, better support. I mean, we know that we have in Northern Ireland, we use discretionary housing payments to cover that shortfall between the local housing allowance rates and the actual rent that people are paying. But in fact, we're finding, our own research found that only around 40% of the shortfall was covered. So there's still a considerable shortfall. I think the shortfall has kind of been normalized, but a lot of you know, private rented sector tenants that rely on support have just come to expect that there'll be a shortfall that they have to pay. But the truth is that if you're on benefits, if you're relying on benefits, that shortfall is coming out of the other benefits that are given to you to support your, you know, yourself and your family. So I mean, it does seem crazy that that's having to be used to pay for rent. So yeah, key asks would be to try and support private rented sector tenants who have to rely on support to pay their rents more fully, and you know, try and increase that local housing allowance or make it fair so that we can have more properties that are fully supported.
Thank you very much, Martina. That's really, really helpful. I know we have a small landlord in the Portsmouth area who's joined us, and Gareth was going to just let Tony join us for a second just to make a couple of brief comments. Tony, welcome. We noticed you put a few comments in the chat, so we'd just be interested to hear some key points or reflections indeed, particularly on the report from your perspective. Thanks. So I think I can see Tony's on the line. I think, can you unmute yourself, Tony?
Is that better?
There you are. Yeah, far away. Thanks for joining us.
Thanks for inviting me. I was rather disappointed until I heard Martina's presentation just now, and I think she's made my biggest point really, that it's down to money. Unfortunately, housing benefit rates are too low, and that I could spend an awful lot of time discussing that point. There are various reasons why it is too low, and we haven't really got time to go into that now. The way it's calculated is, it was calculated before it was frozen, was wrong, etc. And Martina's covered that adequately. If there was more money around, there would be more supply. So the supply problem is not easily, not easy to address, but it is down to money. I do think Jennifer made a good point. Landlords could reduce the threat of eviction. The problem is that too many tenants will not look after the property unless they have the threat of eviction hanging over them. It is not their investment. Not all tenants do see the property as their long-term home. So I was wondering what landlords can do to address this issue. It's not easy for us to remove that threat. We don't know how the tenants are going to behave. So a question there, if anyone's got any thoughts on that. I think landlords or agents seem to be conspicuous in their absence from this discussion, and wondered if there's any reason for that. And then part of the problem is the lack of good and well-trained environmental health officers. In our experience in Portsmouth, they seem to be a pain where they could be seen as a support for landlords. To be fair to Portsmouth, I think they are trying to address this problem, but we haven't seen the results as yet. The environmental officers seem to go for easy targets to justify their existence, rather than challenge the criminal element that take advantage of the poor and the vulnerable. I think those were my main comments.
Sorry, I was muted. Thank you, Tony, and very helpful to have your perspective. And I know that, you know, in terms of the colleagues on the line, these views are really valuable and need to be taken into account. And just to comment on environmental health, it's a chronically underfunded resourced area across the UK, and not just on this topic, but many others. And I hear those concerns. But Jennifer, let me hand back to you just to perhaps say a few comments on the points Tony's raised. Thanks.
I'm just going to respond to the last comment and then hand over to Kim to reply to some of the earlier comments. So thank you so much for your contribution in raising those points. I mean, I think the last one you raised about environmental health officers is a really important one. It's what we're seeing across the UK increasingly is this sort of this implementation gap. So we're seeing increased regulation being introduced, you know, across the UK in the sector, but a real lack of capacity at a local level to not only enforce standards, but also to support landlords. And that's something that we talk about within this report and in previous research that I've worked on, is that actually training and advice for landlords needs to be seen as part of the regulatory architecture of the sector. And one of the other comments that was made in the Q&A box was about the national registration scheme, which currently exists in Scotland. And one of the recommendations we make in this report and a previous study is that local authorities should be using the national registration scheme as a means of communicating with and upskilling the sector. So I think on a local level, yes, we have a very long way to go to ensuring that landlords have that advice and that support and that information. But I think there is also, it's not the only reason, but there is a real kind of capacity and research issue which urgently needs to be addressed at a national government level.
Thanks very much, Jennifer. Kim.
Hi there. I'm just going to pick up on the other point around length of tenancy and reducing the threat of eviction. I would disagree here. I don't think that threat of eviction hanging over tenants is needed. Many other countries, both in the UK and internationally, have more open-ended tenancies and the sector still functions. Landlords still make money. So I would like to see all parts of the UK move towards more open-ended tenancies. I think it offers benefits for tenants, but also landlords. Tenants that are happy in their property are more likely to stay in the property longer. That has benefits for landlords as well in terms of reducing turnover. So I think, you know, we really need to move forward and really get some firmer commitments from the UK government in particular, in the English context, about giving tenants more rights to stay in the property for longer is really important. That ability to create a home is really important to tenants' well-being. And I'd really like to see some positive action on this. And indeed, other groups have been calling for this as well, Shelter, amongst others.
I'd just like to endorse what you've just said. There is research that Indigo House published about the first year of experiencing the new open-ended tenancies in Scotland, and that is going to continue. That's my understanding. We're going to be another 2 years worth of research looking at that, and looking at the first tier tribunal, which is the court, the legal remedy for implementing the requirements in tenancy. While the tenancy agreement is open-ended, tenants can still be evicted under 18 specified grounds. So I mean, I think that could be the sort of solution between the landlord's concern about the behaviour of a tenant, which is obviously if you have a new tenant, you don't know, from a landlord perspective, you don't know what that experience is going to be like. But likewise, from a tenant's perspective, you need to have security and certainty. And we've heard so much about how insecurity impacts negatively on well-being. So I suppose that's from my perspective, that is kind of the halfway house. You have the open-ended secure tenancy, but at the same time you can still be evicted if you behave poorly. And it will be interesting to see. I think because we've only had 1 year of evidence before the pandemic, we don't really know yet what impact that has had, both for landlords and tenants. But certainly look forward to further waves of that research being published.
Great, thanks, Michael. We're having some great contributions in the chat and the Q&A, so I'm just trying to keep up with those. Paddy, again, contributions here from the Republic of Ireland, saying generally there are good relationships between landlords and tenants. Those landlords that are not as supportive need to be targeted, and good landlords encouraged. And obviously, from his perspective, supporting security of tenure for all tenants. Again in the Republic. And then a really interesting comment here from a peer researcher. I'm a peer researcher for a project on young private renters in London and a researcher on housing. And we did a co-design workshop with landlords. I'm sure lots of renters would agree with some of Tony's points, but I would say it was really surprising to see where tenants and landlords agreed and disagreed in the workshops, and how much misconception there is on either side. Sorry, that's just jumped because somebody else has put in a comment. Getting tenants and landlords in the same room is a worthwhile exercise. So I think that's a really good point. I mean, again, I'm not an expert by any stretch in this arena, but I think it can become an issue, can't it, where there's conflict, and I think greater understanding of both sides' perspectives is probably needed. So that's very helpful. I'm just seeing if there's anything else that people have. I think I've asked you all the questions that were in here. I think we have one more, Jennifer or Kim. Reflecting on the tenancies that are going well, could we learn any more about characteristics of length of tenancy, type of landlord, tenant, market, etc.? I don't know who wants to take that. Indeed, anyone on the panel.
I don't mind, I can say a few words and then pass it over.
Thank you. Yeah.
Well, as I mentioned, having a positive relationship with the landlord, that actually seemed, amongst the people we spoke to, that also in some ways seemed more important than tenancy terms. And that's not to say that sort of tenancy terms and open-ended tenancies aren't important. And indeed, as I said, a few participants in Scotland who were aware of changes to tenancy law that suggested that contributed to improved sort of feelings of security. It should be said that sort of people are very, as Michael mentioned earlier, a very, very low awareness of tenancy terms, of their rights. And so that's the key point. But also in highly pressurized housing markets where there was lots of demand and lots of competition for properties, that contributed to a feeling of sort of housing insecurity. As I mentioned, how are we going to stay here if we find it so difficult to find another one. But just that relationship with the landlord, that seemed to be key, that they were responsive to repairs, that they were good communication, sort of, that they sometimes also, that they provided reassurance that they weren't looking to sell. The freedom to personalize the space, absolutely key, where people had that freedom to personalize the space, that contributed to the sense of being at home and happiness in their property. Sometimes also renting from family and friends seemed to be a more positive experience, which I think is something that might be worth exploring further, because there's some issues there if we're relying on sort of intergenerational support to achieve positive outcomes within the private rented sector. What does that suggest for kind of continuing inequality? So it's just something that might be worth looking at further. I'll let Kim, is there anything else you wanted to add, Kim?
I mean, I think really just to echo what you've said there, the things that really stood out to me in looking at the qualitative data was that relationship, that personal relationship between the tenant and the landlord, and really communication. Landlords that communicated well about, when there was going to be works done in the property, or they were come to do an inspection, or whether the rent was going to increase, keeping the tenant in the loop just, took a bit of worry off their shoulders, I think. And also being flexible in the approach, being willing to have pets, allow people to personalise the property, to not have, strict requirements around the tenancy. I remember one family who lived in London, the landlord didn't like them to have visitors staying in the home. Things like that are very restrictive. That was a family home. They told us about how they had to sneak in a tortoise and goldfish, under the radar, because pets are really important to their kids. So it's things like that, recognising, I think, fundamentally, yes, it's a landlord's property, but this is ultimately people's home, and they need to be able to make it home. And if tenants can do that, they're more likely to stay in the property longer. You'll have happy tenants, and I think that makes good business sense for landlords as well.
We do know that there is good practice. That the experiences can be very positive for landlords, and I think that was a point that was made in the report, and we've discussed earlier. I don't know if anybody from Homes for Good is perhaps in the audience, but it's a private sector agency operating in Glasgow and sort of the surrounding area, and I know one of my colleagues has done quite a lot of work with them, trying to develop case studies highlighting the very kind of positive relationships their staff have developed with tenants from all walks of life, in particular tenants with quite significant support needs access the private rented sector.
Thank you very much, Michael. So we're coming to the end. Let me just turn to Martina and then Joe to see if they've got any final comments they want to make. And then I'll just highlight, we've got a feedback form if people are able to complete that. Martina, any final comments from you?
I think just, I was mentioning there in the chat just about something like as simple as the mediation project that Housing Rights are running. It's a pilot project, and that can help that, what Kim was saying about that, conversation, that kind of communication between landlords and tenants can be really, really important, and can sidestep a lot of issues that arise from miscommunication or, misinterpretation or just, issues that people have that they don't want to raise. So that can be done through something like that. So services like that can be really important. And I think it's important also just we're not here to, I'm certainly not wanting to demonize any kind of landlords. And we know that the private rented sector works very well for most people, but the truth is that there are a lot of people that would be better served. A lot of tenants would be better served living in social housing, but we don't have the social housing available for them. And that is why those tenants are ending up in the private rented sector. We're not talking necessarily, I'm not in my research talking about all private renters. It's not a homogenous group. And I think it's important to keep that in mind. And while some landlords are fantastic with tenants who rely on support and haven't raised their rents for many years and don't charge any more than local housing allowance, we know that's the case. But for those that aren't in that kind of good position to have that kind of tenancy, it's very difficult and very precarious place to live. And those are the people that we hear from more than often than not.
Thank you, Martina. That was very clear. And Joe, just any 60 seconds final, any comments or observations from you? Thank you.
I think from a Wales side, I think included in my presentation to do Rent Smart Wales. So obviously in Wales, that is the registration and licensing scheme that is available to look at the management and provision of private rented. The website has got an awful lot of information and advice on there with regards to providing support to landlords and to tenants. There's funding available for new heating systems. As then, just to finish off, as an environmental health officer that has worked in housing, we do want to provide the support to landlords. We are there to help, and I know that there are unfortunately some individuals out there that maybe don't. And just to, you know, as in sort of mirror exactly what Jennifer and Kim have said about the provision of environmental health officers within a housing context, we are minimal. If you compare it to food, and the number of environmental health officers that are providing food inspections, it is, you know, as in sort of 4- or 5-fold to the number of environmental health officers. So yes, we do need more, and we do want to help and work with landlords because we know how important you are in order to provide safe, sound, secure accommodation for those that are most vulnerable.
Yeah, that's a really important point. I'm sure that absolutely applies across the UK as well. So just to highlight to those attendees who are still on the line, Gareth has been putting in the chat, do have a look, there's a number of links in there, but there's also a request to take a few minutes to provide some feedback on today's event. That was at 11:34 because there's a number of comments after that. There is a Google Docs form there if you're able to complete it. So I think it just remains for me to thank all of our speakers. I found this really genuinely very informative. I've learned a lot, and I know that the audience was very engaged because we had so many questions. Apologies if I didn't manage to cover everybody's questions, but just to draw your attention finally to the fact that the report is now up and online, and again the link is in the chat. So we'll close this webinar here. Thank you very much to everyone, and all the best.